All right, now I'm going to do my cranial nerve assessment. We'll start with cranial nerve number one, the olfactory. So we're going to be assessing your smell. So go ahead and close your eyes and occlude one side of your nose. And you tell me what you smell.
Rubbing alcohol.
Okay. And now switch noses, nostrils. And then tell me what you smell there.
Coffee.
Yep. Perfect. So your olfactory cranial nerve is intact. We'll go to your optic. So we're going to test cranial number 2, your optic nerve. We'll test your visual confrontation. So I'm going to have you stand up real quick. And I'm going to try to get eye level with you here. And I want you to cover the same side I'm covering here. You can tell me whenever you see my fingers coming to the picture.
Now.
Okay.
Now. Now.
Okay. Now switch eyes.
Now. Now. Now.
Come from this side too.
Now.
All right. Good. You can sit back down.
Okay.
Your cranial number 2, your optic nerve is intact. So we'll go on to the third, 3, 4, and 6, your oculomotor, your trochlear, and your abducens. So what I'm going to do is I'm going to have you follow my fingers in 6 different positions, okay? All right, good. No signs of nystagmus or anything, so no issues with that, no blurred vision or anything with that. So it appears your cranial nerves 3, 4, and 6 are intact. So we'll test your third cranial nerve again, your oculomotor, with the cover and uncover test. So I'm going to grab a card here. I want you to look right at me.
Okay.
I'm going to cover this side. All right, and I'm going to do the same to the other side. Okay, so there was no in-order outward deviation. Did you have any issues with the vision there? Okay. So it appears your third cranial nerve, your ocular nerve, is intact there too. So we'll test your fifth cranial nerve, your trigeminal nerve next. We'll just do, I'll touch your face with, we have a Q-tip that has a dull end and then a sharper end, and you just tell me if it's dull or sharp, okay?
Okay.
So,
Dull. Dull. Sharp. Dull. Sharp.
good. So it appears her fifth cranial nerve, or trigeminal nerve, is intact. Then we'll go on and we'll assess the same cranial nerve again a different way. So I'm going to have you clench your teeth for me.
Okay.
And I'm going to feel her muscle tone of her jaw and assess her TMJ. Her muscle tone seems very good. TMJ's intact, no issues with that. So once again, her fifth cranial nerve is intact. We'll move on to your seventh cranial nerve, your facial nerve. So what I'll have you do is smile for me and see frown for me. Now can you puff out your cheeks? Now can you scrunch up your face? Purse your lips out. All right, perfect. Seventh cranial nerve, facial nerve seems to be intact. We would then move on to your acoustic nerve, your eighth cranial nerve. So what I'd normally do is take a turning fork. I would, hit it for the Weber test, put it midline on her skull, and then for the Rhine, I would hit it, put it on her mastoid process about both sides, one at a time, obviously, and then over her ear to assess the bone conduction and airway conduction with that. Then we're going to go to the 9th and 10th cranial nerve, the glossopharyngeal and the vagus nerve. I'm going to have, normally I would have some kind of like cotton tip applicator or tongue blade or something to elicit a gag reflex, but unfortunately I don't have that. Then I would have her open her mouth and swallow for me. And I would look for the midline uvula and the rise of it with the swallow, which she has. So appears her 9th and 10th cranial nerves are intact. We would check her 11th cranial nerve, her spinal recessory nerve. So what I'd have her do, I'd hold pressure, get your shoulders down, I want you to shrug up for me. Good deal. And then I would hold pressure against the side of your face, I want you to look the other way. There you go. And then against this hand. Perfect. So seems like her 11th cranial nerve, her spinal accessory nerve, is intact. And we'll move on to her 12th cranial nerve, her hypoglossal nerve. So what I'm going to have you do is stick your tongue out for me. And can you raise it up, down, side to side? So it doesn't look like she has any issues with tongue movement. No tremors, no any kind of weakness seen there. So seems that all of her cranial nerves are intact. that would include the cranial nerve assessment of for nursing 641.